It is not uncommon to hear that regular consumption of coffee in large quantities has a negative effect on the cardiovascular system and also contributes to a shorter life expectancy. Is this true, or is it a common myth? We will try to understand in detail so that you will not have any more questions. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Coffee drinks are known to have an energizing effect due to their high content of a substance called caffeine. It is a psychoactive substance, a purine alkaloid that can stimulate brain function and increase metabolism. Nowadays, caffeine can be found, in addition to coffee, in most energy drinks, Coca-Cola and tea. The substance is also actively used in migraine tablets, as well as a stimulant of cardiac activity and respiration. On average, already 20 minutes after taking caffeine, a certain number of processes are triggered in the human body. For example, the receptors of the neurotransmitter adenosine are blocked, the main effect of which is the slowing of nerve impulses and the appearance of drowsiness. This increases reaction speed, attention, and suppresses relaxation. We can also note the stimulation of the production of the hormone adrenaline, which increases heart rate, increases blood flow to the muscles, and the release of glucose into the blood. In addition, levels of the neurotransmitter dopamine, which is known for inducing feelings of satisfaction, well-being, and general emotional uplift, are also increased. Spinal reflexes are activated. The central nervous system is excited. Vision, sense of smell, and hearing are heightened. Intellectual and physical endurance is increased, as well as the ability to work. But after 2 hours, the effect of caffeine sharply begins to decline, which leads to the reappearance of drowsiness and lethargy without repeated use of coffee drinks. Caffeine is able to be eliminated from the body naturally within 4-5 hours. In order to understand whether regular caffeine consumption is beneficial or harmful, it is necessary to first understand how it affects the body as a whole. First, let's understand what happens to the blood vessels when caffeinated beverages enter the body. It is scientifically proven that the strongest effect of caffeine has on the blood vessels of the brain. This explains the invigorating and stimulating effect of the beverage. In addition to the content of caffeine, the drink contains another alkaloid, theobromine. It actively affects the condition of the walls of the circulatory system. It is important to understand that different vessels, when coffee enters the body, behave accordingly differently. Some of them expand, and others conversely narrow. The vessels that undergo dilation are those that supply nutrients to the cardiovascular and musculoskeletal systems. The dilation of the bloodstream occurs as a result of the relaxation of the vessel walls, so that blood flow becomes more intense, activating the flow of oxygen to certain organs. This explains the stimulating and invigorating effect. In this case, a person immediately begins to feel a surge of energy, increases his efficiency, and improves mental abilities. This effect is quite often craved by people seeking to cheer up and gain strength for certain work and duties. Especially creative individuals, athletes, students, and truckers often fall into this group of people. When drinking coffee drinks, caffeine enters the bloodstream and begins to spread to all tissues and organs, stimulating the release of adrenaline. This leads to increased tension in the walls of the circulatory system, narrowing of the arterial lumen, and spikes in blood pressure. The latter effect can have both negative and positive consequences. If coffee is consumed in moderate doses, there will be no negative effects, as pressure spikes can help strengthen the strength and elasticity of arterial vessels. However, with an increase in the daily dose, even absolutely healthy vessels may not be able to cope with such a large load. Especially people with a history of atherosclerotic disease can feel it, because the deposition of cholesterol formations provokes the detachment of blood clots from the walls of blood vessels, which is fraught with the development of heart attacks and strokes. With the expansion of the bloodstream, feeding all the organs of the excretory system, significantly increased urination. With urine is removed all the accumulated toxins and poisons in the body. However, along with it is washed out and calcium and other useful compounds. When drinking coffee in the amount of no more than 2 cups per day, the deficit of minerals is not particularly felt. However, When the daily dose increases, the scale of leaching of useful substances increases, which has an extremely negative impact on health. For example, you may notice a decrease in the strength of bone tissue, nail plates, tooth enamel, and hair. Another unpleasant consequence of coffee consumption is the appearance of pain sensations of varying intensity. This occurs about 60 minutes after drinking the drink because of the dilating effect on the vessels of the brain, digestive organs, and pelvis. As a result of narrowing the lumen of blood vessels, decreases the amount of nutrients and oxygen to the organs. Since the consumption of these substances also drops, this may help to reduce pain, including headaches. The alkaloid is found in some pain-relieving pharmacological agents because it has a number of beneficial properties, including pain relief, activation of natural brain processes, relieving passivity and drowsiness, increasing the ability to concentrate, stimulating mental activity, speeding up decision-making, and enhancing physical abilities. Certain effects of alkaloids dilate the bloodstream in the heart, skeletal muscles, lungs, and kidneys. Their effects cause certain reactions of organs and their systems. Due to the fact that caffeine dilates the vessels of the heart muscle, its blood supply is improved. In general, it increases blood supply to areas with minor current restrictions in atherosclerosis. There is an activation of peripheral circulation. Hypotensive agent normalizes blood pressure, moderately stimulates kidney function, improves renal blood flow, accelerates blood perfusion of lung tissue, which contributes to blood oxygenation, activates blood supply to the muscles, accelerates the withdrawal of lactic acid after intense physical activity, accelerates the recovery of damaged muscles, increases the contractile ability of the lungs and lungs. It narrows the vessels of the gastrointestinal tract, which promotes active secretion of digestive juices, and also relieves cystitis pain due to narrowing of pelvic vessels. As for the effect on the heart, perhaps the best-known negative effect of caffeine is an increase in heart rate and blood pressure, which is directly related to the main action of the alkaloids. Caffeine is a central nervous system and brain stimulant. It helps speed up certain physical reactions, and it also stimulates the heart and dilates blood vessels. Of course, it is impossible to say exactly how much caffeine is needed for it to begin to have an effect on increasing heart rate and blood pressure. But still, there is an average figure. Only 50 milligrams is needed to get such an effect. However, sensitivity to this alkaloid is still individual, which means that the dose leading to the development of tachycardia can be either more or less than 50 milligrams. It is even possible that caffeine has no effect at all. However, it turns out that drinking coffee can also protect the heart. A group of people who drank 2 to 3 cups of coffee drinks a day had a significantly reduced risk of heart problems compared to those who drank more or less coffee. Just 1 cup a day is already enough to reduce the risk of stroke or death from cardiovascular disease. One of the main concerns about the effects of coffee on the cardiovascular system is the increase in blood pressure. However, this effect is usually very short-lived. Most people who suffer from hypertension can consume caffeine in moderate amounts, as long as there is no worsening of symptoms. It has also been found that long-term coffee drinkers may have a lower risk of developing hypertension because coffee contains a unique component called chlorogenic acid, which has antioxidant properties. This helps keep heart muscle cells young and healthy. In addition, caffeine has a positive effect on the tissue inside the blood vessels and heart. When this tissue is functioning properly, it allows free blood flow and hence a healthy heart muscle rhythm. Chlorogenic acid takes an active part in the process of blood clotting and also helps platelets to linger on the walls of blood vessels. In order to get the maximum effect from drinking coffee drinks, it is necessary to understand what kind of coffee is the most useful. Numerous studies have revealed that filter coffee is best. This is a beverage that is prepared by pouring water once through ground coffee placed in a filter. As a result, the water seeps through the powder. The coffee acquires a rich flavor and also retains all the beneficial substances. The coffee grounds are discarded at the same time. It is rightly considered the best choice among all methods of coffee preparation, because in such a drink, the maximum benefits of coffee beans are preserved, and there is no harmful sediment. This coffee reduces the risk of death from cardiovascular disease and contains many antioxidants, which helps to keep cells young. The least useful is unfiltered coffee, that is, the one with coffee grounds in it. Such a drink is brewed directly in the cup. Less healthy than filter coffee is also coffee from a turbo or French press. This is due to the fact that unfiltered coffee contains about 30 times more cholesterol than filtered coffee, which creates a greater burden on the heart and promotes the development of atherosclerotic plaques and blood clots. It is necessary to know about the advantage of ground coffee over instant coffee. Of course, it is much easier and faster to prepare coffee from ready-made instant powder. However, it is in such a drink is less useful because of the addition of various preservatives. In addition, in the process of preparing instant powder from coffee beans, all essential oils and useful elements practically disappear. In order for the powder to have the property of dissolving in water, it is subjected to multiple processing, depriving the remains of vitamins. It can also be added various stabilizers, flavorings, dyes, dry cream, and sugar, which does not add any benefit to the drink at all. It also contains much less caffeine than ground coffee. However, despite all the advantages of properly prepared quality coffee drinks, they have a number of contraindications. Thus, their use is not recommended for people with hypertension and disorders of blood supply to the brain, with severe heart disease, head injuries, increased intraocular pressure, with varicose veins, aneurysms, thrombophlebitis, and atherosclerosis. From the use of coffee drinks too, it is better to refuse to avoid the development of complications. It is not recommended to consume coffee for 14 days after any surgical intervention, especially if it involves the heart or brain. Above 60 years of age, it is also better to avoid drinking coffee as it can lead to increased strain on the heart muscle. If you are in a stressful state, with severe nervous tension after a sleepless night, coffee can provoke such negative consequences as a general deterioration of health, loss of strength, nausea, dizziness, and headaches. Also, you should not drink coffee after or before physical activity. Even perfectly healthy people should carefully monitor the amount of coffee they drink and try not to exceed the permissible dose. What are your thoughts on the subject? Do you agree with these statements? If you have any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.